Well, hello everyone and welcome. Welcome to the Patricia Raskin Positive Living Show on VoiceAmericaMedia.com. This is our 24th year on Voice America and very proud of it. I've had my programs on many different networks and many different forms from radio to TV to internet to podcasts, but I've stayed with this one along with the others for this time, and I'm very proud to be here. This is the program that shows you how to turn your problems into solutions and your obstacles into opportunities and make your dreams come true. We have a very interesting topic today. We're talking about mental health and we're talking about what we can do to help people. My guest today is Dr. Peter Hartmann. He is a distinguished physician, MD, who spent 5 decades bridging family medicine and psychiatry. As a U.S. Air Force veteran, Dr. Hartmann trained at the University of Maryland and Sheppard Pratt Hospital, taught at leading medical schools, and has published extensively on mental health and medical integration. Now retired, Dr. Hartmann currently blogs for Psychology Today, and he's the executive producer of Voyage Media's hit podcast, The Mind Doctor, an 8-part series based on real-life medical mystery cases from his career, which are gripping. Welcome, Dr. Peter Hartmann.
Thank you very much for having me, Patricia.
Yeah, you're welcome. Well, and I know that your podcast, The Mind Doctor, focuses on psychiatry and mental health issues. Tell us a little bit more about why you wanted to do this particular topic and how you made it into a podcast. How did it come to be?
Yeah, sure. So when I was doing my family medicine residency, my program director happened to be one of the leaders of general practice that wanted to create a new field that they called family medicine. So it was a 3-year training program rather than just the 1 year required to be a general practitioner. And they thought that the general public wouldn't know what a family physician was versus the general practice. And they had this interesting idea to have a television series about a family doctor, which would then educate as it entertains people. And that's how Marcus Welby, MD, was born, a very successful TV show about a family doctor. Well, when I did my psychiatry training, and after that, I did both family medicine and psychiatry. I didn't switch to psychiatry. I did both for many years. And I realized that many people didn't really know how a psychiatrist was the same as or different than the various therapists like psychologists and social workers and others. If I had a nickel for every time people introduced me as being a psychologist, I'd be rich. But I'm not a psychologist. I highly admire them. They play an incredibly important role in the care of patients with mental illnesses or complaints. But that's not what I am. I had to learn a lot of psychology to be a psychiatrist, but we play a different role. Psychiatrists are first and foremost medical doctors. We go through medical school. Our first year of training involves internal medicine or pediatrics or family medicine. We have to take a certain number of rotations in neurology. And then we can start learning the psychiatry. And this is important because part of our responsibility in the care of mentally ill patients is determining the cause. So, for example, someone can be depressed as a side effect of a medication, or they may be highly anxious because their thyroid gland is overactive. And the treatment for those is not therapy. It's changing the medicine in one case or treating the underlying thyroid disease in the other case, just as examples. So you have to be a medical doctor to make those distinctions and to be aware of how you sort them out. So that's part of it. Also, we're the only ones that are legally allowed to order tests and order certain physical treatments. So psychiatrists play a unique role. Some psychiatrists do therapy just as the therapists do, but most don't anymore. They understand therapy, they have some training in it, so they know the role that it plays. But I was one of those who did both because I enjoyed that, and my training at Sheppard Pratt included a lot of therapy training. And I found it very helpful in working with patients with significant illness for me to be aware not only what I'm doing in therapy, but also what medications I'm using and watching out for side effects and so on.
Okay, so let me ask you,
Yeah.
I know that season one of Voyage Media's new medical mystery, The Mind Doctor, just launched in July. And you're
Yes.
the executive producer, and there are 8 episodes, and each one is inspired by your real life experiences, as you said, as a family practice and as a psychiatrist, both. Um, so for listeners who haven't tuned in yet, what is the podcast about?
Well, it's about psychiatrists in a university medical center in Baltimore, but it's a fictional one. There are two real ones in Baltimore, but this is a fictional place. And there are three major psychiatrists that play a role in this particular series. The lead one is the head of the forensic psychiatry division, and he has these other two associates in that same division. So some of the cases will involve medical legal matters, like let's say terrorism or something like that. So in addition to that, the lead person is trained in internal medicine as well as psychiatry. So he's very interested and expert in the mind-body connection, which was an area of my particular interest because of my dual training. So this is really about their interaction with patients, their personal lives, their interactions with one another. It's intended to be very entertaining, dramatic, but also as a side effect being educational, because people can observe psychiatrists at work
Hmm.
and what they do and what they
Dr.
don't do.
Hart, yeah.
Yeah.
Dr. Hartmann, do you narrate it? Are you the interviewer? Do you speak? Do you have guests on? What's the format?
Okay, I have no speaking role in these episodes. These episodes are highly dramatized cases. You have professional voice actors who do the voice work. There's a professional engineer involved and others. So I was involved in providing the cases and explaining them. My goal was to make them as realistic, medically speaking, as possible. So it's nothing fantasy. These are actual real diagnoses. Now, to be clear, they're not necessarily specific cases of people that I saw with them, but they are cases that are well known in the literature and are real cases. Some of them are quite rare, but they're very fascinating, and that's one of the reasons we included them.
Right. And the Mind Doctor in this summer in 2025 reached number 2 on the drama podcast charts on Apple Podcasts, which is wonderful, and congratulations. Why
Yes,
do you think
thank you.
listeners are so fascinated by these medical mysteries and these true medical mysteries, the way that we are with crime?
Mhm. Yeah, I think it's fair to say that people in general find medical drama to be fascinating. Just think about all the television programs that are already out there, ER, PIT, uh, House, the list goes on. So people find it fascinating. And I think that's partly because we all face illness and health issues. We're interested in those things. And so when we can see it dramatized on television, it's very interesting.
Yeah. Is there any one theme that you see in all these? Are there like motives of passion or anger or unrequited love? I mean, are there certain themes that come through these medical mysteries?
Well, the primary thing would be the variety of different types of mental illnesses that exist and that need to be diagnosed and treated, and the ways in which they have to be treated. So it's that sort of technical aspect of the medical conditions. But we're also learning a lot about our protagonists in terms of their personal lives. For example, the lead character, Dr. Bruce Young, is a brilliant physician trained in both medicine and psychiatry, but he has gone through a divorce, which he deeply regrets. He has a son who has a substance use disorder, and this brings problems into his personal life, and he'd like to get remarried if he possibly could. So these are not just doctors doing doctoring things; they're also human beings with
Mhm.
the same foibles and problems and challenges that we all face in life.
Right, right. And you've written about narrative as a tool for healing. How do you
Yes.
think that storytelling itself can become part of the medicine?
Well, it's through the education that you get without even realizing it. I took a course called Media and Medicine from Harvard Medical School, and actually that's where I got the idea of creating this television series. And I did that during my training. And I learned in that course that you can use health cases in television stories or television series that are done as a story, but actually educates the population as they watch it. So an example was in one of the shows on television, they had an individual who came in who had a cancer of the cervix. She had gotten an infection and she didn't know about how to protect herself from it. She didn't know about the vaccine and that sort of thing. And so that was kind of discussed on the show. And researchers, before the show came on, they actually interviewed people and asked people in that age range, teenagers, what did they know about the HPI infections? And then they redid it after the show, and they found out there was an increase in knowledge about it from having watched the TV show. And what one would hope is that as a result, there will be more young women and young men who get the vaccine, and there will be less cervical cancer in the future. So that's an example of the story resulting in education that results in a positive change in health.
Right, great. All right, I'm going to take a break. And when we come back, we're going to talk more about the series, The Mind Doctor. We'll talk about some other things like loneliness, which is an epidemic in our country. We'll talk about happiness, which has been talked about a lot, but really, what's the science behind it? And several other things coming up in these episodes. Just want to repeat that my guest is Dr. Peter Hartmann. He is a distinguished physician who spent 5 decades bringing family medicine and psychiatry and bridging them together. He's a U.S. Air Force veteran. He trained at the University of Maryland and Sheppard Pratt Hospital, taught at leading medical schools, and has published extensively on mental health and medical integration. Now retired, Dr. Hartmann writes blogs for Psychology Today, and he's the executive producer of Voyage Media's hit podcast, The Mind Doctor, which is an 8-part series based on real-life medical mystery cases from his career. Stay tuned, folks. There's a lot more right after the break on happiness, on understanding loneliness, on understanding anxiety and depression as well. We'll be right back. Hi, everyone, and we are back. You are listening to the Patricia Raskin Positive Living Show right here on VoiceAmericaMedia.com. You can hear us on YouTube. You can hear us on Voice America Media. You can hear us on Libsyn as well. My guest today is Dr. Peter Hartmann, who is a distinguished physician who spent 5 decades bridging family medicine and psychiatry. He is retired now. He has taught at leading medical schools. He trained at University of Maryland and Shepherd Pratt Hospital. He now writes blogs for Psychology Today, and he's the executive producer of the new hit podcast, The Mind Doctor, which is an 8-part series based on real-life medical mystery cases, and it's very gripping. So welcome back, Peter,
Thank
Dr.
you.
Hartmann.
Thank
Okay.
you.
All right. So, couple of other questions here is how did you come up with the title, The Mind Doctor?
Well, that's interesting. The word psychiatrist means doctor of the mind. And
Oh,
because I wanted people to have a deeper understanding of the role of psychiatrists in the diagnosis and care of people with mental illness, I thought, well, why not call them the mind doctor?
yeah, that's great. You know, I know you're retired now, but why do you think it's so important to understand the connection between the mind, right, mental health and physical health?
Well, they actually feed one another. The brain is an organ in the body, and it has branches that spread out throughout the entire rest of the body, and the body communicates to the brain. Now, the mind is really a function of the brain. It's essential that you have a brain to have the mind. The way I think it's easy to try to think of it is that the brain is kind of like hardware, like a computer, and the mind is like the software, like, say, a Microsoft program. So the software kind of tells the hardware what to do. You might get an upgrade in your software, and it's going to change what the computer does. And you may even need to upgrade your computer for more sophisticated things. So the brain is kind of like the computer, and the mind is kind of like the software. And so they work together. And there's a deep connection between the brain and the rest of the body. A good example is with the gastrointestinal tract, the GI tract. They talk to each other ongoingly. That's why there's this notion of having a gut feeling, because people
Hmm,
realize that your gut acted up when certain things were going on in your mind.
yeah.
And actually, there are nerves in the wall of the intestine, and they connect directly to the brain. There's a large nerve that comes out of the brain stem at the back of the brain that travels and wanders around into the heart and then all through the intestinal tract. And so it's
Hmm,
sending information from the brain directly to the GI tract, and the GI tract is sending back information. In
interesting.
addition, the GI tract has that microbiome, that collection of bacteria and viruses and
Yes.
fungi that live there. Well, that has a huge impact on our immune system that also then
Hmm.
communicates back to the brain. So there's
Hmm.
this bi-directional communication between the brain and the
Yeah.
rest of the body.
Question. When you talk about the mind and the brain, and the mind being more the software,
Yes.
so is the mind really in control? In other words, is my mind telling me so for example, I'll give you an example. I'm very upset about something, let's say, and
Yes.
my first reaction is to get really angry and really effusive. But
Hmm.
my mind says, no, 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 we're not going to do that. We're going to
Hmm.
breathe and we're going to stay calm.
Right.
And my mind is telling my brain. So is it my mind that's directing?
Well, I think it's actually a combination of the two. They're hard to fully separate. You won't have a mind without a brain, and your brain won't do much without a mind. So they're really feeding each other. So, for example, think of the brain as 3 layers. The first layer is at the bottom of the brain. We call it the reptilian brain because it serves the
Right,
same functions that reptiles do. And
right.
it just handles these automatic things like breathing and the heart rates and things like that. The next layer is called the limbic system, and that really has to do largely with our emotions. And that can happen virtually outside of your conscious awareness. For example, if you see a danger situation, for example, it looks like a car is going to crash into you, within fractions of a second, a part of your brain called the amygdala lights up and it says danger, danger. And it sets off a whole cascade of things that change your body in significant ways in an effort to try to deal with whatever this danger is. Now, the newest part of the brain is on top of that, and that's the cortex, and especially the front part called the prefrontal cortex. That's where the executive function of the brain lives. It prevents you from making too many rapid decisions. It makes you stop and think. That's where the software is helping you to make good decisions. That's where when you learn how to control your temper by counting to 30 or however way you do it, that resides in that part of the brain. The problem is it lags behind the limbic system. So the first thing is the anger, the sense of fear, whatever it is. And then finally, your prefrontal cortex catches up to it and starts saying, hold on, we've learned how to deal with that by doing this, that, or the other thing. And that's why you count from 1 to 10 or 1 to 100 or 1 to 30. The research says 1 to 30 is the best. If you want to not act on your immediate fear or anger, you need enough time for that information to get from the deeper brain into the prefrontal cortex where you've learned all these methods of dealing with it.
Do animals have a prefrontal cortex?
They do, but they're proportionately much smaller and less well developed. Humans have, see, we have a huge brain. That's why, sadly, women suffer so much in childbirth. Whereas if you look at animals delivering, they don't seem to suffer a whole lot. But that's because the size of their baby as they're coming out of their womb is small relative to the size of their womb. However, in human females, because of the large size of the head, which is normally the part that comes out first, it's going through a very small passageway, and so it's very, very uncomfortable. That's one of the prices human beings pay for having such a large brain, but that's what enables us to write poetry and go to the moon, and monkeys don't.
Well, that was so interesting when you said that about the prefrontal cortex. I thought, well, then we have that ability to stop, right, and not to hurt somebody or reach out. Whereas when you watch animals, they just react. So that's why I asked you, because you don't see the animal stopping and going, oh, well, maybe I want, the animal just goes for it.
Right. They're much more instinctive in their actions. And that's because they do not have a large enough prefrontal cortex.
Yeah. Let me switch a little bit and ask you, what's the real impact of physical health on mental illness? Right? Think about that. I mean, and why do you believe that the medical system needs to treat them together? Because we can develop mental illness from physical health issues.
Absolutely. And the reverse can happen. So it's bidirectional again. So I gave you previous examples of someone with an overactive thyroid gland who becomes extremely anxious. So that's an example of a general medical cause of a psychiatric condition. We call it anxiety disorder. On the other hand, if you have ongoing anxiety, that's going to affect your body. You may not sleep as well. And we know sleep deprivation is a serious problem for your general health. It's going to have an impact on your blood pressure and your pulse rate. And if those are not well controlled, that creates problems for your arteries, and you can get heart disease and strokes and things. So each one affects the other. They're really integrated, and we have to keep in mind that the brain is an organ, just like your heart, your lungs, or your gallbladder. It really has to function in concert with the entire rest of the body. And so there are these bidirectional informational systems. So your body tells your brain about the temperature outside, and it tells you what kind of sensations you're having on your skin, and that sort of thing. And then on the other hand, your brain is telling your body, what to do about it, how to react to it, what sort of feelings to have.
Yeah.
So it's bidirectional.
Yeah, I have an interesting question I just thought of. We've heard so much recently, and I know this show's evergreen, but we hear a lot about shootings and organizations and schools and faith-based organizations. And my question about that is that if we know all this about the brain, right, and we could see it on a scan, if you had somebody who was predisposed to, let's say,
Mhm.
hurting people or, being a shooter in a school shooting, can you see that on the brain? Can you see, well, gee, there's maybe the prefrontal cortex isn't as developed.
Mhm. Well, generally speaking, people who engage in mass shootings, for example, don't have significant mental illness per se. They are
Okay.
more distressed by their anger over how they were treated, that sort of thing. They may have personality disorders, which can play a role, certainly. Sometimes people are mass murderers not because they're enraged, but as part of their fundamental value systems and beliefs. For example, they may be
Mm-hmm.
anti-Semitic and therefore want to kill Jews.
Mm-hmm.
So it's not a single thing, but most of the ones that we're really concerned about, these school shootings that occur, it's because of prior experiences, usually at that school that the shooter has had. They feel often left out. The young men feel like girls ignore them, and they've never gone on a date as a result. And this
Mm-hmm.
rage just kind of builds over the years, and they finally decide to take it out on what they
Right.
perceive to be the source of their anger and upset, which
Mm.
is that school
So,
that they went to that allowed them to be
right,
bullied and ignored and so on.
right. So it's not about the size of the brain or the way it's configured. It's about their life
No,
experience
it's
and the
really life
feelings.
experience. Yeah. Now,
Yeah,
personality issues do play a role as well, and
yeah.
we know that our personality is roughly 50% genetic. So the genetics do play a
Interesting.
role. It's part of the
Interesting.
biology of the brain, but it's also life experience that's the other half. So,
Yeah. All right, we're going to take a break. This is so fascinating. When we come back, we're going to talk about, some of the cases that are on the podcast series. We'll
mhm,
ask Dr. Hartman if he felt this case was unsolvable, but did a breakthrough happen? We'll also talk about loneliness and happiness. Certainly, loneliness has been a big issue in our country, our culture
mhm,
since COVID, and it's still there. And of course, with social media, people are not always socializing, they're socializing through their machines. And
mhm.
so
Right.
we're going to talk about that when we come back. You're listening to
Okay.
the Patricia Raskin Positive Living Show. Dr. Hartman is an MD, distinguished physician who spent 5 decades bridging family medicine and psychiatry. He is the executive producer, now retired, of Voyage Media's hit podcast, The Mind Doctor. We'll talk more after the break. Stay tuned, folks. Hi, everyone, and we are back. We are back talking about mental health, about the mind. Now we're going to talk about happiness as well. My guest is Dr. Peter Hartmann, who is a distinguished physician who spent 5 decades bringing and bridging family medicine and psychiatry. He's now retired. He taught at leading medical schools. He's published extensively. He writes blogs now for Psychology Today, and he's the executive producer of the new podcast, The Mind Doctor, which is based on real life medical mysteries. So I want to talk about that first. Um, I want you to think about maybe one case, because each episode's based on a real medical mystery that stands out
Mhm.
to you. How psychiatry helps solve the medical problem, how it was dramatized.
Sure. Well, I could pick any of them, but the one that just pops into my mind is the prisoner who developed what we call a conversion disorder. A
Hmm.
conversion is not like a religious conversion. It's a term that Sigmund Freud came up with. Back in his day, there were lots of people who had neurological complaints, and he was a neurologist, not a psychiatrist. And he and his colleagues found out that it wasn't a physical condition, but a psychological condition for a number of people. And what he thought was the energy in a certain part of the brain got converted into a different form of energy in another part of the brain. So he called it a conversion disorder. He was trying to explain in his own mind why it was that someone would have a neurological complaint, such as blindness or an arm being paralyzed or what have
Hmm.
you, when there was no neurological explanation for it. And what he found out was that under hypnosis, those symptoms would go away. And that's what made him understand that this was really an underlying psychological condition. So, in the
Hmm.
case in question, this young man who's in prison becomes enraged at a fellow prisoner who's really been picking on him and trying to get him to join a gang that he doesn't want to belong to. And he has this urge to hit him and finds that his arm is paralyzed and he cannot. So he had a
Wow.
conversion disorder, a reaction that actually protected him from doing
Hmm.
something that was against his values. But he had
Wow.
this sudden anger and urge to do that. And I've seen a number of patients with fascinating conversion disorders. For example, people with epilepsy can have not only real epileptic fits, but they can have ones that are psychologically driven. There's no electrical activity in the brain causing it, it's purely psychological.
Hmm.
I saw people who were paralyzed from the waist down, they could not walk. And it turns out when you find out what was going on with them, that it was an unconscious solution to a life problem that not being able to walk solved for them. And
Really?
once you discover that, then you can work with them and make the paralysis go away. I had
You
one
can make,
patient where,
well,
pardon?
Dr. Hartman, you
Yes,
can make the paralysis go away?
yes, yes, that's the whole goal. And I had a particular interest in that, so I often
Oh,
got
because it's not a real paralysis. Because it's
exactly.
not a real
They
paralysis.
truly can't walk. It's not, they're not faking it. Now, there are people who have a factitious disorder where they're making it up, but I'm talking about people, they truly
Right.
cannot walk, but it's not because of nerve damage. They may have
Got it.
fallen and then were paralyzed from the
Very
waist down,
interesting.
but their MRI scans are normal, all their reflexes remain normal, all the testing we do to see if it's a true neurological problem are not there. So then you think, okay, well, is this a psychological or what we might say psychosomatic condition? And that's
Hmm.
where I come in.
That is absolutely fascinating. And what are some of the techniques that you use to help them gain their function again?
A lot of it's gaining insight, finding out what was going on. What did this change in their physical capabilities? What did that do for them psychologically and socially? So, for example, in the case I mentioned in this series, the person wasn't able to punch someone, which would have caused him to have to stay in prison much longer. And plus, which this guy was
Hmm.
much bigger than him, and he might have, really severely harmed him. So it
Right.
saved him that way. And so when you realize what's going on and you can discuss it with them, you can make conscious awareness of what that was serving you for, and that can enable them to give it up. I also used a lot of what I call suggestion therapy. So, for example, I had a patient who was paralyzed from the waist down. It solved a problem that she was having within her life, but it turns out that the circumstances had changed while she was in the hospital, and she no longer needed that paralysis to deal with that issue. And so I became aware of that just by interviewing her. She was very open and talked to me quite readily. So what I told her was that I had reviewed her MRI of her back. I read the notes from the neurosurgeon and the neurologist, and I said, I have good news for you. You have a type of paralysis that responds very well to physical therapy, and I predict that you will be able to walk within 3 days. That was my
Wow.
suggestion. Now, she was already transferred to a unit where they did physical therapy. So that was on one day. I came back the next day to see her and follow up, and she wasn't in her bed. And so I asked the nurse, where is she? Is she down for an x-ray or something? No, her doctor's discharged her earlier this morning. She was able to
Mm,
walk after just
mm,
2 sessions of physical therapy.
mm,
Well, the
mm,
reason it worked so readily and faster than I expected was because of this suggestion that she had the type of
mm, mm.
paralysis that would respond to physical therapy, and it did, and it went away. So that's
Wow.
sort of the ways in which I would approach it.
Can you do some of that through hypnosis as well
Yes,
as talk?
yes, you can. And I have done hypnosis. I was trained in that actually as a family doctor and found it very helpful for a lot of things. So you
Mm,
can, and that's what I say. Sigmund Freud and his colleagues were using hypnosis to treat these patients very successfully.
mm.
But he got sort of tired of going through that process, and he thought, maybe if I just let them sit down and just start talking, maybe it'll come out what the underlying issue is. And that's what he found. And that's how uh, somatic medicine was really kind of developed in his hands.
Yeah, let's talk about that, somatic medicine.
Yes.
Um, a lot of people don't understand exactly what it is in
Mhm.
terms of, the feelings and understanding the reactions in the body. Explain it, please.
Okay. So somatic just means the body, something physical going on. Psychosomatic, a psycho meaning the mind interacting with the body. And so some of it is the example that I gave of these conversion reactions where the person has an apparent neurological complaint, but nothing wrong with their neurological system. But other times it's really more stress related, that the stress in their life is causing them to have real physical problems. So an example of that would be someone with ongoing stress, their brain and body are going to react as if there was a saber-toothed tiger ready to attack them. This is an ancient thing within us to protect us against that kind of danger. It's that fight or flight response. We either fight the tiger or we try to run away, or
Mhm,
possibly we'll just freeze in place in hopes that he won't see us.
mhm,
But we prepare our bodies to be able to run or to fight, which means we need to shunt the blood away from the GI tract and into our muscles. Our muscles will need more oxygen and sugar in order to have the energy needed to fight or to run. We're going to need to increase our heart rate and the strength of the contractions in order to make that blood flow increase. And our adrenal glands will start pumping out a hormone called cortisol, which helps to
mhm,
protect our bodies in the event of serious injury. That's all well and good if there is an immediate problem and it goes away. The problem is if you have ongoing stress, you're going to have lots of cortisol constantly released, adrenaline released, your heart rate's going to be in excess of what it should be, your blood pressure is going to go up. And this is all harmful to your health, particularly your heart. And
mhm,
the cortisol, when you have it for too long, affects your brain functioning. You can have more anxiety and depression. You can have more
mhm.
immune problems and so on.
As I'm listening to this, I'm thinking about listeners listening to this, and
Mhm.
I'm already understanding what I think your podcast does. I
Mhm.
mean, you've already explained to us what the conversion is that I didn't
Mhm.
know about,
Mhm.
and a lot of people don't. And so I think that what you're saying with the podcast is you're teaching people through these
Mhm.
stories about these kinds of things that are real,
Right,
that can really help them, that aren't always talked about that much. So
right.
it's really important. Yeah,
Mhm.
thank
Yeah.
you. All right, we've got a couple minutes before break. So I want to ask you this because in the next segment, I definitely want to talk to you about happiness and about
Mhm.
loneliness, because I think that's
Okay.
important. But I do want to ask you this. In terms of just one thing you'd like people to get when you think about it from everything that you've done, is there is there a message?
I guess the message, I would say messages rather than a single message, is that mental illness is very, very prevalent. It's increasing in frequency, especially anxiety and depression. It affects your body and your lifespan adversely. And the mind and the body are connected. One can affect the other. And we need to have a holistic view of our patients, not just mental illness, but what else is going on.
Yeah, absolutely. How can people hear the series? Do they just go on to Apple Podcasts?
That's probably the easiest way. Go to Apple Podcasts and just type in the search line, The Mind Doctor, and it should pop up for you.
And you
Another
have
way,
eight, go
I'm
ahead.
sorry.
You have 8 episodes.
Yes, there are 8 episodes. You can listen to each one individually. You don't have to go through all 8 at once. Each one lasts somewhere between 25 and 30 minutes.
Okay.
So most people don't do it all in one sitting, so to speak. Some people like to do it when they're driving. They turn it on and listen to the podcast. There's nothing to see. It's all auditory.
Mhm.
And so you can do it, while you're doing other things. Now, I was going to mention that I do have a brand new uh, website, and on my website, all of them are listed, and you can just touch it on the screen, and then you can listen that way too. So you can either go to Apple
And the
Podcasts.
website is
Okay, it's Dr. Peter, Peter, Hartmann, Hartmann, all small letters.com. And it'll take you directly to
easy,
my site.
easy, drpeterhartman.com.
Yeah.
Terrific.
Now,
Right.
not doctor all the way, it's just Dr. for doctor, but drpeterhartman.com.
Okay. And they can listen to the podcast. They can see what else you're
Right,
doing.
right.
And if they need resources, they can write to you. Is there a place they can
Yes,
write to
there's a
you?
place on there, especially if they're interested in a presentation, say on happiness or loneliness, I can do that.
Okay.
If the circumstances are right. Also,
Okay.
on my site, I have my blogs. I have these blogs that I do monthly for Psychology Today, and you can just touch the screen and it'll take you directly to my blogs. I also do blogs actually on WordPress that I've been doing since 2014, and they're not just psychiatric issues, but general medical ones as well. In fact, probably more
Okay.
general medical ones than psychiatric.
Right. And the blog is on the website too. We
Yes, you
can get,
can.
yeah.
Yes.
Thank
Yeah,
you.
exactly.
Wonderful. All right. We're going to take a break. And when we come back, we are going to talk about happiness, the science
Mhm.
behind it, what makes people happy. We are going to talk about loneliness and health concerns relating to loneliness and what we can do about it. And again, my guest is Dr. Peter Hartmann, distinguished physician who spent 5 decades bridging family medicine and psychiatry. He's taught at leading medical schools. He currently writes a blog for Psychology Today. He is now retired. He's the executive producer of Voyage Media's hit podcast, The Mind Doctor, which is an 8-part series. You can log on to his website, Dr. Peter Hartmann, DrPeterHartmann.com, to
Mhm.
find all of this material. Stay tuned, folks. We're going to talk about happiness and loneliness next. We'll be right back. Hi, everyone. We are back. We are now talking about happiness and loneliness, and they actually can be related, which we'll find out about in a minute. My guest is Dr. Peter Hartmann, a distinguished physician who spent 5 decades bridging family medicine and psychiatry. He is now retired. He writes currently a blog for Psychology Today. He's the executive producer of Voyage Media's hit podcast, The Mind Doctor. He trained at University of Maryland and Sheppard Pratt Hospital, taught at leading medical schools, and has published extensively on mental health and mental integration. So welcome back, Dr. Hartmann.
Thank
All
you.
right, let's talk about, first I want to talk about loneliness, because I
Okay,
think that's really an epidemic in our country,
it
particularly
is.
since COVID.
Mm-hmm.
So
Mm-hmm.
I'd like you to really talk about health concerns and what we can do about it.
Sure. So loneliness is a bit of an epidemic in our country, and that was actually recognized by Vivek Murthy, who was the Surgeon General of the United States in recent past. When he would travel around the country, he found out that people felt isolated, invisible, and insignificant. And so he put together a whole team to study loneliness and found out it was a significant cause of general medical illnesses and psychiatric illnesses. So, for example, physical illnesses, if you're lonely, you have an increase in heart attacks and heart disease and stroke. You have high blood pressure, diabetes, and the infection rate goes up. It can also increase cancer rates. So loneliness is a very serious problem for our physical health, as you would expect, but it also increases rates of depression, suicide, and anxiety. And it's a real plague for our country because there's so much of it. And it seems to strike the elderly the most, and then the next most would be our young adults. And some of that's because of social media. Unfortunately, we don't interact with each other so much anymore. You might go to a restaurant and sit down and see a family, or a father, mother, and two children, and they're all looking at their iPhones and not even looking at one another or talking to one another. So we've kind of created a loneliness epidemic in that way. COVID obviously made it all worse for obvious reasons. We were all so isolated. And people move a lot nowadays. It used to be you born in one town, you grew up there and you stayed there and you had friends from your school there. Now you travel all over the country and you have to meet new people. Some people are good at it and some people are not. So it's a serious problem in terms of our physical and mental health, in addition to which it just doesn't feel good to be lonely.
What can we do about it?
I think the first step is to figure out, why are you lonely? For some people, it's because they have a disability. For example, they're restricted to a wheelchair and they don't have somebody to help them to get out and get into the public. Some people have loneliness because they have vision or hearing problems. And like, for example, if you can't hear people's conversations, you kind of withdraw into yourself, and so you become lonely. So find out why you're lonely and then try to deal with that. So if it's the problem is that you have problem with your hearings, then maybe you can get some hearing aids and change that. That's important, by the way, as an aside, because hearing loss is associated with early onset dementia. So it's an important issue medically as well. So find out why. Get new friends, talk to your neighbors, join a club, uh, go to a community center, take a class. For example, elderly people can often take free college classes at a local college, and you can meet your classmates. Maybe your professor might even be your age and that sort of thing. So you have to go where people are. Also, the AARP, they have this program called the Experience Corps, where they connect an elderly person with a student in college, and they help one another. So the student might come and shuffle their sidewalk for them when it snows, and the elderly person offers wisdom and a listening ear. And a lot of young people don't have any adult who really listens to them and cares what they are, experiencing, what their thoughts and feelings are. So that's important. And actually, one of the suggestions that I have is if you have a young person in your life, ask them how they're doing and how they're feeling and mean it. And say, no, I really want to know. And that can make a huge difference if they're aware that there's an adult in their life, whether it's a parent or a teacher, a coach, someone who does really care what's going on with them.
Yeah, absolutely. Very good advice. Let's talk about happiness. let's
Sure.
talk about the science behind it.
Hmm.
And, I read a lot about here are the 10 things that happy people do. Here are the 8
Hmm.
characteristics of happy people. But I think
Yeah,
it goes beyond that. So let's talk about the science.
sure. So I think the main thing is to know what is the number one factor in your life that determines your happiness and your health and longevity. There's an 85-year study done at Harvard University. I won't go into the details, but they were looking at all the factors in your life, how much money you have, what kind of work you do, how smart you are, your level of education, your health, you name it. They studied all of it for 85 years. And they found out that one thing overwhelmingly determined your level of happiness, your well-being, and your success in life. And that was your relationships. That's
Mm,
overwhelmingly number one. That's where
mm,
your energy needs to go.
mm,
And that's why the loneliness epidemic is so tragic,
mm,
given that relationships are critical to
mm.
your happiness. So we know that for sure.
What about money? How big of a factor is that?
Sure. So money doesn't buy happiness in one sense. That is to say, billionaires are no happier than millionaires and so on. It turns out money does help you with happiness if it's necessary or because it's necessary in most cultures to receive your basic needs, food, shelter, and so on. That costs money. Once you reached essentially what we would consider middle class level of income in this country, you will not be any happier than if you start making more money than that. Now, money
Interesting.
can increase your happiness in three ways, besides those essential needs that you have. The best way is if you use your money to benefit others, charity, essentially. Another way is to buy time. Why do you buy time? Well, let's say you have a large lawn, you hate mowing the lawn, and you're lucky enough to have enough money you can hire someone else to do it. You've just bought yourself time because you're not mowing the lawn, which you hate. Instead, you can use that hour or 2 hours, whatever it is, to do something you do enjoy. So, you can use money in some ways to increase your sense of well-being. But by itself, once you've reached the essential needs that you have, more doesn't make you
Yeah.
happier.
Wonderful. Such profound and things that are common sense, but we don't always think of and we don't always hear, and you're
Mhm.
giving us the science behind it. We've
Right.
got about 2 minutes. So
Okay.
what are your closing thoughts, Dr. Peter Hartman? What would you like to leave our listeners with today?
Well, I think happiness is very important, obviously, and I would just say that there are three features of happiness that's worth knowing about. So one of them is enjoyment. The second one is satisfaction, and the third is meaning. Those are the three macro elements of happiness, and so you need to focus on them. This is something that Arthur Brooks from Harvard talks about.
Yes.
So,
Thank
an enjoyable life, enjoy things, certain pleasures and all. They're very valuable and worthwhile. Have an enjoyable life, like you're enjoying what you do for a living.
Mhm.
Satisfaction, that really has to do with work and study where you earn your success. And that's very important for happiness. So if you cheat on exams and get a good grade, that doesn't make you happy. If you studied hard and you got a good grade, that makes you happy. So earning your success, you're satisfied. You have goals in your life and you're striving towards them and it's working.
Mhm.
And then meaning, you have to have a meaningful life, something that's
Mhm.
transcendent, something that's
Mhm.
beyond your ordinary life.
Yeah.
So those
Thank,
three things are the core features of what happiness
thank you.
actually is.
And thank you for a wonderful interview, inspirational, educational, um, all the things that you talk about that are so important in the podcast, and also educating people, but also enlightening and entertaining them. So, Dr. Peter Hartman, it's been a pleasure to interview you today. And I know the website is drpeterhartmann.com, PeterHartmann.com.
Absolutely. Yes.
Thanks so much for a great interview.
Well, it's my pleasure and thank you for having me.
Oh, you're welcome. Stay on the line for a minute. All right,
Okay.
folks, that wraps up this edition of the Patricia Raskin Positive Living Show. If you'd like to get a copy of my newsletter where you see all these wonderful guests on every month, that's what I do in my newsletter. Comes out the first of every month. Write to me, Patricia at patriciaraskin.com. Also, if you would like to get your positive message out, I've interviewed over 6,000 people in my career, and I'd love to help you create your own podcast. So contact me. I'd love to help you. Again, Patricia at patriciaraskin.com. Remember, stay healthy, stay happy, get the support you need, and know you can make your dreams come true. Until next time, I'm Patricia Raskin. Bye for now.